Hello, welcome to my channel. The title of my video today is Peri-Operative Nursing. This is part 3, questions and answers from RN NCLEX examination. Please hit the thumbs up button. Please subscribe. Please share this video with your classmates. Before I get started, my first question is, who is a scrub nurse? Correct answer, your scrub nurse assists the surgeon with surgery, maintains surgical asepsis, draping the patients, handling instruments and supplies is the correct answers. What is the responsibility of the circulation nurse? The correct answer, the circulation nurse assists with admission of the patient to the OR, assists with positioning the patient on the operating table, helps with monitoring devices, count numbers of instruments, needles, gauzes, syringes used is the correct answer. What are your 4 types of exudates? The correct answer is serous, sanguineous, sero-sanguineous, and purulent drainage. These are your correct answer. What will be your expected outcome for your post-operative patients? Correct answer, skin should be clean, dry, and intact. CDI. Clean, dry, and intact. Patients should be free from neuromuscular damage. Have the patient turned and repositioned every 2 hours. Get the patient up out of bed the morning or the night of surgery in a chair, ambulating the hallway, prevents DVT in the legs, prevents pain, swellings in the legs. Check the pulses, make sure they are palpable. If they are weak or absent, notify your doctor. Patients should be expected outcomes. Patients should have symmetric breathing pattern. Make sure your patients are using their incentive spirometers 10 times for the hour. They should be doing it 6 times for the hour. Every 10 minutes, ask them to blow in the incentive spirometer. We want lung expansion, prevents them from developing post-operative pneumonia is your correct answer for expected outcomes for your post-operative patients. What is the definition of ablative? Correct answer for ablative, removal of diseased body part or tissue or its function. Removal of diseased body part or tissue or its function is the correct answer. What's the definition of reconstruction? Correct answer, to restore function, to traumatize or malfunctioning tissue. What's your definition for palliative care? Correct answer, to relieve or reduce intensity of illness. Palliative care does not cure. Patients coming up from surgery with a Jackson Prat. Why is a Jackson Prat placed after surgery? Correct answer, to decrease dead space by collecting drainage after abdominal or breast surgery. Your patients will come up with Jackson Prat tube. You will empty that as needed, PRN. When you empty, you will document your output drainage The drainage will be serous, sanguineous, bloody drainage. Next question. Why would a doctor request an emergency informed consent? Why would a doctor request an emergency informed consent? Most correct answer, most of the time you'll find a doctor calling the families for an emergency informed consent. Maybe the patient did not complete one before on admission. But at this point, the patient is unable to give consent. The patient needs emergency surgery. The patient needs emergency procedure. The doctor will go on the phone and call the next of kin for emergency informed consent. At this time, a nurse will be at the phone with the doctor as a witness. My next question is, which drug causes electrolyte imbalance? The correct answer is diuretics. Patients who are on diuretics, for example, Lasix, monitor their potassium levels. If the potassium levels are low, notify your doctor to replace the potassiums IV or orally. My next question, which surgical risk is related to obesity should be considered by the nurse? The correct answer is delayed wound healing and wound infection is your correct answer. What is PAR? Correct answer, PAR stands for post-anesthesia recovery. Next question, what does PACU stands for? Correct answer is post-anesthesia care unit. Next question, for your post-operative patients, what is the most important intervention to prevent cardiovascular complication? And the correct answer to prevent cardiovascular complication post-op is exercise. You have the patient turn every 2 hours. Next morning of surgery or night of surgery, you get them up out of bed to sit in a chair. Let them go walking as tolerated down the hallway. They need exercise to prevent cardiovascular complication after surgery. My next question, which vitamin promotes collagen synthesis, promotes wound healing and epithelialization? The correct answer is vitamin D. Note, vitamin D can be given in supplements. Vitamin D source is sunlight. Note, calcium needs vitamin D. Calcium should be administered with vitamin D, assists with absorption of calcium. My next question, which phase of wound healing does client have a generalized body response? Mildly elevated temperature, leukocytosis, malaise, and the correct answer is in the proliferation phase is your correct answer. My next question, post-operative incision is red and inflamed. What is your assessment? What could be causing this incision to be red and inflamed? And the correct answer is contamination. Contamination. Use your sterile gloves when doing your dressing, prevents contamination of wounds, prevent wound infection, use sterile gauze and saline, sterile water to do your wound dressing is the correct answer. My next question: indicate how cardiovascular diseases place clients at greater risk for post-operative complication. And your correct answer: increased potential for hemorrhage, hypovolemic shock, hypotension, venous stasis, thrombophlebitis, overhydration of IV fluids. When you're doing your IV fluids for your patients post-operative, make sure your IV fluids are going at the correct rate, post-operative order. Do not increase the rate of your IV fluids if you are behind. Communicate with your doctor. You need doctor's order. If you feel you have a need to speed up your IV fluids, patients are at risk for overhydration. My next question: indicate how pulmonary diseases place clients at greater risk for post-operative complication. And the correct answer: increased potential for respiratory depression from anesthesia, post-operative pneumonia, atelectasis, alteration in acid-base balance is your answer for patients with pulmonary diseases. Next question: indicate how patients with kidney and liver disorders place clients at greater risk for post-operative complication. And the correct answer is influences the client's response to anesthesia, affects fluid and electrolyte, as well as acid-base balance, alter metabolism, alter excretion of drugs, and impair wound healing is your correct answer. Post-operatively, patients will have SCDs on, stands for sequential compression device, SCD. Post-operative, correct answer: post-operatively, SCD prevents thrombophlebitis, DVT, blood clots. Assess pulses. If they are weak or absent, notify your doctor. Redness, blueness of the calves, swelling, notify your doctor. Stat: patients with difficulty breathing and chest pain, this is an emergency. Chest pain is always an emergency. Patient at risk for pulmonary embolus, please hit the thumbs up. Please subscribe with that black button. Please share these videos for your classmates and friends. Thank you. Have a good day. My next video is on pharmacology, part 1. There was a problem with that video. I had to redo it. Have a good day. Thank you.